to the Kent Lapp Podcast.
Where do you see the state of healthcare in America today? How would you assess it?
It's a mess. It's an absolute mess.
And why is it such a mess when we're one of the wealthiest, more successful, more cutting edge countries in the world? Why can't we fix health? Why is healthcare a mess in 2020 in the United States of America?
Yeah, because there's no market forces, right? There's zero market forces being played on healthcare right now. Like, you can go to the dentist and you're paying it out of your pocket, right? And so you can call the dentist if you want to, and you can figure out what's the cheapest dentist in town. You can figure out what you can go online and see what the quality is. And so you can make that decision in your mind. It was like, how much am I going to pay for the quality that I'm willing to get? For cosmetic surgeries, for LASIKs, all these things that are being paid out of your pocket. The cost is, let's talk about, I can go to get my dog, looked at for the vet for $40, right? I can't step into a doctor's office without it being $250, and I'm sorry, but it's not that different.
Yeah.
It's like, but I'm paying it out of my pocket. And so there's market forces that are associated with that. Right. And so I'm on the dog side.
Yeah. Okay.
On the dog side.
Yep.
So, given that there are no market forces, healthcare is just go crazy. And in addition, healthcare insurance companies actually have an incentive to increase costs, not to reduce costs. So at VRI, I was actually selling into health plans. That was my number one thing. So I was selling into health plans to reduce costs for their most expensive patients. The problem we have is that the Affordable Care Act has something called the medical loss ratio, which means that for every dollar you bring in, a certain percentage of it has to be spent on care, right?
For every dollar you bring in a hospital?
Sorry, for every dollar the plan makes. So so let's say I'm making up a health plan. I'm not using this health plan for any specific reason other than it's well known. Let's just say United Health, right? Biggest health plan in the country. For every dollar that they bring in, so every dollar that me as the insured gives to United, they have to spend 80 to 85 cents of that on my care, on care in general. Let's just say. So let's just say they make $100 million, which is way more than that, right? They have to spend $80 to $85 million of that on the actual care of those patients.
Oh, wow.
Okay. So that is mandated by our federal government. Okay. So if you think about this, the only way for them to make more money is for revenue to go up. The only way for more revenue to go up is that they charge me more. Right? And so they're actually incentivized to increase costs.
Whoa.
It's crazy.
That's insane.
And in addition, there's this incestuous relationship between those insurance plans and the big hospital systems. So, if you think about this, right, there's two major hospital systems in Austin. There's a third major hospital system in Texas. And so really there's only like 4 big hospital systems, and everybody wants to go to those hospital systems. And so the health plan has to pay those hospital systems a pretty good amount of money to take care of the patient, or else the hospital system is going to say, okay, United, we're not going to be a part of your plan, right? And so there's this, they're in cahoots with each other to increase costs. And that's why we're screwed, right? And so let me give you one just quick example. So I work for a nonprofit, which means that they didn't give insurance, which means I had to go on the marketplace, the healthcare marketplace, run by the federal government. So I was in a plan, and my daughter, Caroline, had ear infections, right? So she had to get tubes put in her ears. So we go over to Dell Children's, and that she's there for 45 minutes. And I know this because I'm texting back and forth with my wife. How's she doing? She just got in. She just got out. So from the time she walked in to the time she got out of the hospital was 45 minutes. That procedure was $8,000 for 45 minutes. And I was on a high deductible plan, so I had to pay $8,000 for this.
And the inventory required to perform that procedure, or the raw materials,
Zero.
didn't cost. Oh, zero?
I mean, it was probably, the tubes in her ears are probably $5 or something.
Holy
I mean, it's
cow.
they're just little rubber tubes.
So your expense was labor.
Yeah, labor.
Quote unquote labor, but like what else was
in
it?
the room, right? You
Yep.
had to rent the room out. And so I'm like, well, hold on a second, right? Like I even asked before how much this was going to be, and they couldn't tell me how much it was going to be, right? And so I was just kind of like, okay, like I'm sure it's not that bad, you know. It was $8,000. The other thing that was really weird is they said it was an inpatient procedure, which means you stay in the hospital, right? Versus an outpatient procedure, which is you go to the hospital and you come home. She clearly went to the hospital and came home after 45 minutes, yet they refused to make it an outpatient procedure. It was an inpatient. And by making it an outpatient, they could charge you for the room over an overnight stay, right?
By making it an inpatient, right?
By making it an inpatient.
Okay.
Yeah.
So they did that.
So they did that. And so I'm $8,000 out. And I went and I fought it and I battled it, and nobody would do anything about it. And like, what am I supposed to do? If I don't pay it, guess what? The hospital comes after me, you know, and hurts my credit scores. And
Absolutely.
And so it's a totally screwed up system.
Golly. Okay, explain.
One other quick, interesting data point. I saw data just a few weeks ago from a state who has about 80,000 employees in their state. And
80,000?
80,000 employees for the state. They are insured by a big branded one that you would know, big insurance company. And so there's this, I saw this data from a company that just does some data mining of these things. And they have, one of them was really interesting where it was, they had 200 people go in for an ACL tear. Okay. So an endoscopic repair of the ACL. Okay. The minimum they were charged was $2,500. Guess how much the maximum was?
20 grand?
$55,000. So they were charged for the exact same procedure, no changes, no differences, the exact same code, between $2,500 and $55,000.
Based on what?
Based upon how much the provider charged them.
Wow.
And so it's just there's no market.
Oh,
forces.
okay. There was different providers that were performing these different services.
One would do it for $2,500.
Okay.
One was doing it for $55,000.
Yeah, different hospitals.
Yeah,
right.
Different hospitals,
Gotcha.
but the same state.
Same state and same procedure.
What is that? A 2,000% difference? Or I don't know. I'm bad at math. Somebody can do the math, but like a massive disparity. Mm-hmm. And so, you know, if I go down and get Twizzlers at Walgreens, it's going to be the same at Walgreens and CVS and HEB and whatever your grocery store is. Like, because there's market for it. We know exactly how much it's going to cost. Mm-hmm. And that's just not happening in healthcare. So we need transparency. We need to know how much these things cost. Mm-hmm. And we need to figure out how to make you and I incentivized to actually shop for the services.